I guess I started speaking out about the gas industry in the NT earlier in the year after our Chief Minister announced the greenlighting of fracking in the Beetaloo basin, because I felt that there had not been really any discussion about the health impacts of these projects. And I was worried about the people living around these gas wells and what was going to happen to them once they started exploring for gas. And then I started looking into it a lot more and then discovered that it won't only be the people of the Beetaloo that suffer from this, it's also going to be the people of Darwin. Because the gas from the Beetaloo basin will be piped all the way to Darwin Harbour and Middle Arm, where it will be processed into LNG and petrochemicals. I was really worried that the only thing the government was talking about was jobs and how good it was going to be for the Northern Territory. And I guess as a medical professional, I was really interested in what do these projects and the extraction of gas, what effect does that have on people? And that goes even beyond the climate change effects, and we'll talk about that as well. But what effects do these projects have on local people? So when gas is extracted from these production wells in the Beetaloo basin, they spew out pollution, which contaminates the air. It contaminates the surface of the ground, goes into the groundwater. The fracking can also disrupt the aquifers underneath and contaminate them for good. So these are irreparable contamination events that are permanent. And these kind of effects then cause the health impacts that we see in large populations who live around fracking wells. And so they experience much higher rates of asthma, and that's because the pollution in the air gets into the lungs. It affects children more than other people because they breathe in a relatively higher amount of pollution per body weight. And so they have much higher rates of asthma presentations. The air pollution also gets into the lungs, the bloodstream, and can then affect pretty much every organ of the body. And so if you think about the children's grandparents and parents who might have diabetes, heart disease, the air pollution makes all of these diseases worse. And so it can actually increase death in the people living around these fracking wells because of their exposure to this pollution. And then the pollution, if there is contamination of the soil and then the water, the people around the Beetaloo basin depend on groundwater for their drinking water. And by the time anyone finds out about any contamination event of this water, the people drinking that water will have been exposed for a very long time. And we know from research in America that populations living around these fracking wells have much higher rates of stillbirth, congenital abnormalities, lots and lots of pregnancy complications, preterm birth. And we know that in the Northern Territory, particularly out in the remote communities where this fracking will occur, we have some of the highest rates of preterm birth in the country. We have really high rates of stillbirth and congenital abnormalities already, which we can't cope with. Our hospital system, as you all know, is heaving. We cannot cope with any more disease. Then the gas will be piped to Darwin, where it will be processed into LNG. We already have 2 LNG plants in Darwin, which already spew out pollution into our air. So we have some of the worst air quality in the country. And there's kind of some air quality apps you can look up on your phone. You can look it up from day to day and find out how much particulate matter, particularly particulate matter 2.5 is particularly important because it can get into your lungs. Just have a look at where Darwin compares to the rest of the country for air pollution. And I think you'll find that There is, our air quality is much worse than most of the rest of the country. We are a small town. Our air quality should be good. And yes, some of it will be due to fires, but some of it will also be due to the gas industry. Now, once the gas industry, they're going to make LNG, which will be exported to Japan. So we'll get the air pollution from the LNG plant. But then they're planning on building petrochemical factories. I don't know if any of you know about petrochemicals, but there's a lot of really good evidence coming out that they're really dangerous, particularly when they're being manufactured in your town. So there's an environmental approval out requesting approvals to make petrochemicals such as ethylene for plastics, methanol, ammonia, urea. We know that with some pretty good research coming out of the USA and Europe and Asia, that communities living near petrochemical factories have a 30 to 60% increased risk of leukemia and other cancers. This is particularly a problem in children. The risk is higher the closer you are to these factories, and particularly high if you live within 8 kilometres of a petrochemical facility. Palmerston will be 3 kilometres as the crow flies from Middle Arm. Just think about that for a minute. How many thousands of people will have a 30 to 60% increased risk of leukemia and other blood cancers? And this is just the cancer we know about that's been researched. Blood cancer is quite an easy cancer to research because it tends to happen more quickly than other cancers. But there's lots of other cancers that can be triggered by petrochemicals that take a lot longer to develop. So we're yet to see the increases in those type of cancers because these industries are relatively new. And what they've also found with this research is that it didn't matter how good the regulations were that were put in place for these petrochemical factories. The risk of cancer remained the same despite better technology and better regulations over time. So for the government to say that there is no risk and there is no worry here because we have the best regulations in the world, it doesn't matter how good the regulations are, and the regulations put in place are not that good. I've read the Shariba and I've read the Pepper Inquiry. They are not going to keep us safe. The only thing that will keep us safe is to not put the fossil fuel industry, LNG plants and petrochemical facilities at Middle Arm. That's what will keep us safe. And the thing is, we don't need any of these industries anyway. All of this stuff is being exported overseas to the international market. So our people in Darwin and our people around the Beetaloo basin, they are being sacrificed for the sake of multinational corporate profits. And I don't accept that that is even remotely okay. And I think it's really important that as a community, the community is informed about what the risk is to them. If we are going to accept these industries, we need to know what the risk is to our kids, to our parents, to our grandparents. We need to know, and that's free, prior and informed consent.
Thanks for watching. If you like watching our videos or if you learned something new, let us know by leaving a like. And if you share this video on your social media or send it to a friend, that really helps us to get the message out. See you next time.